Good morning, everyone. This is Carly Bell with Vitality Forever and Zenergy Athletic Club and Spa in Sun Valley, Idaho. Today's discussion is back pain. Now, it could be back pain that is due to a sciatic nerve impingement, could be back pain from a gentle herniation, could be back pain from stenosis. Now, in general, there are a few things you could do to support yourself so that the pain is less severe for all of these scenarios. And the number one most important thing to remember when dealing with back pain is that it's often due to anterior tightness and posterior chain weakness. Our objective is to loosen those muscles that could be pulling on the anterior superior part of the vertebrae, causing stress within the spine, and then re-engage appropriately the posterior chain muscle groups. Oftentimes it's the glutes that are inactive that need to reawaken. So in today's series, we are going to discuss some general and simple things that you can do to really change your pain sensations and maybe even stop them from occurring altogether. Let's begin. Did you know the most important piece of all movement is posture? Posture is the beginning and ending in every movement we do. So, I'm going to encourage you to become conscious of how you're standing again. Remember, when you began learning how to move, what muscles you needed to recruit to do the job. Everyone, stand up. Now, for alignment purposes, bring your feet directly underneath of your hips. Check to see that between the big toe and the second toe, you're pushing down. Then from there, you can trace your finger up to the front of your ankle, which then hopefully aligns to the front of your patella, travels up and aligns to the center of your iliac crest, and finishes at the armpit. When we stack our joints in alignment, we are at less risk for degradation, discomfort, or pain. Now, with stacked bones, let's hug the muscles into those bones. So everyone push the ground through the heel and through the bar of your foot. In fact, it's 60% of your body weight being held into the heel and 40% in the ball of the foot. Draw your quadriceps up and in, squeeze them tight. Then squeeze your glutes and maybe even tilt your pelvis up slightly. From this position, extend the fingers long beside your thighs, not in front of your thighs. Lift up through the chest, draw in through the stomach, let the head retract back over on top of the neck. And feel your power, your stability, and your balance when you are engaged with your muscles and your joints are stacked. Remember, oftentimes it's the brunt of our pain is coming from our joints not aligning correctly and not having the support needed to align. So let's give our structure support. Let's re-engage to reawaken and be pain-free. That's step one. I'm going to encourage you to stay in a strong, powerful posture as often as you can. Think about this being the new routine and the new pattern of standing rather than something that is only that you do when you're training. Second thing we're going to proceed with, of course, if you have any knee issues, refrain or be cautious and careful. We're doing two different types of lunges here, a long low lunge and a 90-90 lunge. Let's begin. Step back with your left knee. From this position, let your body come forward. I'm dropping my pelvis down towards the ground in an anterior tilt. From here, extend the left arm and the fingers up to the sky. Then reach over laterally across your body. I'm using my right hand and my right elbow as a support to ensure that my right knee doesn't collapse in. You do the same. Hold this stretch for about 30 seconds with intention and focus. Second stretch, the 90-90 lunge. Elevate the torso, bring back your front foot, tuck your back toes, scoop your pelvis up so the pubic bone is up towards the nose. Engage the glute really tight. Concentrate with all of your might and keep that engagement and the tilt. Anchor down the ribs. Reach up your hand to the ceiling. Now turn the palm away, twist the body slightly, and lean back if you have the space. Be sure to keep the right knee open and hold tight here for another 30 seconds. After you've completed 30 of each of those, you'll then change sides. Long low lunge first. Reach and extend. Come across the body. Hold. 90-90. Bring it back. Reach up. Turn the hand away. Twist the body slightly. Lean back. Be sure to squeeze your right glute as well as draw the pubic bone up towards your nose. Come down. Now from here, we're going to lay on our back. Once you feel comfortable in this position, I'm going to encourage you to try a 4 square. Cross your right ankle on top of the left thigh, interlace your hands behind the left hamstring, and use your right elbow to open up the right piriformis. Hold into this 4 square stretch for 30 seconds. Then do the other side, of course. Interlace the fingers behind the right hamstring. Use your left elbow to keep the left knee open and pull. You're here to challenge yourself, but don't go into pain. Let your pain sensation be the guide. The next thing we're going to do is place our feet flat on the ground. I'm going to have you slowly just rock the knees back and forth. Bring your feet together. Soles are going to touch and knees are going to separate out wide. So this is the last of the stretches for a regular routine of maintaining no pain in the back. To activate, which is just as important, we're now going to begin with a glute set. So in this therapy set of engagement, you're going to squeeze with all of your might and isolate just one glute. Extend one leg long. Draw your other knee in. Interlace your fingers behind your knee at the hamstring. Let your leg be lazy and relaxed. Concentrate fiercely now on the long leg's butt cheek. Squeeze it, hold it, contract it, and don't let it waver. If you're unable to hold the contraction or it lets go during the duration of our 60 seconds, then you're going to grab hold of it again with your focus and your intention. Time yourself, 60 full seconds, contracting and squeezing in this isolated space as much as possible. After your 60 seconds, then change sides. You'll begin the glute set on the other leg. You'll squeeze with all your might. This other leg is completely relaxed and there's nothing happening, and your left butt cheek is working really hard. Hold it here. 1, 2, 1. Our second activation exercise is coming into a vacuum combined with a glute bridge. Here, you're going to take your lower back into the table, the mattress, or the floor. Draw your pubic bone up towards your nose, anchor down through the ribs, and suck in your stomach muscles. Be sure to not push them out. Allow your hands to drape open, palm to ceiling, beside your hips. You must turn your toes up into dorsiflexion at the ankle. Maintain that engagement. Keep your tilt. Now concentrate in squeezing your butt cheeks. Curl, not lift, your hips all the way up with the glutes at the maximum contraction. We're going to do single side glute bridges. My focus now transfers to the right glute only. It is the primary mover to lower down halfway, then lift up all the way. For 15 full reps, I'll stay on the right side as the primary mover, and the left is just going along for the ride. Then switch cheeks. The left glute is the primary mover as you lift and lower 15 reps. After you're done 30 total, 15 on each side, squeeze your glutes, keep them up. Don't let them go. Here we go. Third activation exercise. Open the knees and close them. You have 30 elevated clamshells. Concentrating, holding in your stomach muscles, keeping your vacuum, squeezing your inner thighs together, opening up as wide as you can. Don't forget to keep your toes up so you work your tibialis anterior. Continue on that for 30 reps. When you feel safe, please begin to roll like a log onto your stomach. You will reach one arm up, let the other arm cross over, and then roll onto your side. Now, in this position, we stay in a Sphinx pose. The elbows are going to come slightly in front of the shoulders. The palms are like starfish hands, and you're going to elevate all the way up. Hold it up. Keep it up. Nice and tight. Draw down the scapula blades so you're coming into a downward retraction of the scapula blades. Your chest and your heart will lift through your arms, and you're contracting and squeezing your back muscles against the spine. From our contraction, we're almost creating space between the vertebrae. For 2, and for 1. Gently come all the way down. From this position, take your hands here besides your armpits and to the width of your chest. Squeeze together your shoulder blades so that the hands end up lifting off the ground and come up and then down. 30 full times. Good. With support, push yourself back into a child's pose. Lengthen out your body and your spine. Hold yourself nice and long as you drop your chest all the way down towards your thighs. Hold that for about 30 seconds. Now, I know that you probably are getting relief by continuing on doing forward folds. And when we bend forward into flexion, we get a gentle release, but that doesn't fix the root cause of the issue. Most often, the root cause is due to asymmetries from overactivations and underactivations of the muscle and the structure. So I encourage you to really see versus just feel your straightness and alignment. Use mirrors, use a trainer, use your friend to help you stand up straight. Keep those shoulders back, lift those eyes, squeeze the glutes as often as possible, and build up your posterior core strength. If you have further questions, I'm here for you. Don't hesitate to reach out. You can contact me directly at 208-720-2242. That's it for now. And this is just a small smidgen of what else we could do. Take care.